Are you sick and tired of calorie counting and feel your weight is holding you back in everything you do, including your confidence? Are you thinking of weight loss surgery but are skeptical about the claims and also the potential risks? Or have you already had weight loss surgery and now, a few years down the track, it appears that you are still miles away from your health goals? If you answered yes to any of the above questions, I may have some very useful information to share with you. My name is Dr. Arun Dhir, and I'm a gastrointestinal and bariatric surgeon. I've practiced weight loss surgery now for over a couple of decades and currently practice in Melbourne, Australia at a university teaching hospital. I am also a health and wellness advocate and have spoken at several platforms. Over the course of my surgical career, what has always been driving me is, what can I do to help my clients get a superior result such that they can enjoy a better quality of health? After all, health is wealth. What I am presenting to you today is the result of many hours of research and study that I have put in, and it may be critical to determining one's long-term health and success from a weight loss surgical procedure. Now, when it comes to weight loss surgery, people choose surgery as the last option. Understandably, it is a risky option. However, let's not forget that surgery has been shown to be the most powerful and most durable option out there in comparison to medications, diet, and exercise in one or other combination. And this article from a renowned journal supports this view. The problem is weight loss surgery has also got a failure rate. And in some studies, the weight regain rate at 5 years after surgery has been up to 40%, which means 5 years after having had weight loss surgery, almost 1 in 3 people will be back to their original weight before they had weight loss surgery. That is not good news. However, the information I'm going to share with you has the potential to provide you long-term success with results that stick. Now, before we move further, I want you to know that obesity is one of the 4 big killers in our society today. And these killers are diabetes, cardiovascular disease, including heart attacks and strokes, cancers, and of course, obesity. We used to think that sugar causes diabetes and eating fatty foods causes high cholesterol, hence heart disease. Only half true. It has now become clear that there is one common factor that links all of the above 4 major killers, and that is inflammation. Inflammation literally means on fire. For example, when you injure yourself, your immune system rushes white blood cells to wherever the injury happened to kickstart the healing process. However, when this inflammation is left turned on for prolonged periods, it causes damage to body's own healthy tissues, which is the basis of the 4 big killers that I mentioned earlier. Now, how can this background information help us achieve success with weight loss surgery? Stay tuned. There are 3 common weight loss surgery options available: laparoscopic sleeve gastrectomy, gastric banding, and gastric bypass. And each procedure has its own pros and cons. However, they all achieve the following 2 things. They reduce the stomach size such that after surgery one can fit in less food and feel full sooner, helping one to eventually control calories consumed. Secondly, the operation brings about a change in the brain signaling by change of hormones such that there is reduced appetite or hunger. Both the above factors lead to weight loss. However, if attention is not paid to the 4 key areas I'm going to discuss, long-term success will always remain a distant dream. Now, you might feel that you may know bits and pieces of the information I'm about to present. However, what I have discovered is that this information becomes truly worth its weight in gold once it is applied as a program, and the results are truly compelling. So let's get started. The concept is that of integrative weight loss surgery. Integrative weight loss surgery, as the name implies, is a holistic approach to helping one achieve superior outcomes after weight loss surgery by balancing one's gut microbiome and by reducing the body's inflammation, the two main factors that govern our health. Key area number 1: stress management and mindset. It is known that increased stress not only causes gut inflammation, lethargy, a weakened immune system, but also makes us go for those high-calorie foods such as chocolates, muffins, and cakes. It is almost like our system is exhausted and is demanding a reward. Lack of adequate sleep is a very common cause for stress. Stress management using meditation-based techniques is known to improve body's healing ability and makes us more aware of the food choices we make. Besides, it brings our body and mind into balance, which forms the critical first step in helping one achieve a lasting change. Key area number 2: gut detox, diet and nutrition support. A gut detox program, if practiced for as less as 10 days, allows the gut lining to become healthier and rids the system of accumulated toxins to a large extent. This is one of the key areas where inflammation starts and leads to a host of other medical problems. Reducing the intake of inflammatory foods, which flare up the fire of inflammation, and by taking more of the foods which suppress it, will allow the body's metabolism to function optimally. A healthy, nutritious diet complemented with recommended nutritional supplements is the key to resetting our metabolism and achieving high energy levels. Key area number 3: exercise and breath control. It is well known that exercise releases several hormones in our body that uplift our mood and provide better internal biochemistry. As your heart begins to pound and muscles stretch, it releases several happy hormones into the bloodstream which uplift our mood and helps us stay motivated. This also strengthens our body's immune system. The same is true of gentle, focused breathing exercises that help reduce gut inflammation and reset our metabolism. The final key area of focus is gut microbial imbalance, and this is a biggie. Latest scientific discovery confirms that what makes the human gut so unique is the 100 trillion bacteria that call it home and live in a very harmonious relationship with us. It turns out that these bacteria are crucial to our health by maintaining a healthy immune system and by running a healthy metabolism. When the gut bacteria are out of balance, our health is out of balance. This is when we put on weight easily and seem to struggle to lose it. The father of modern medicine, Hippocrates, said, "All disease begins in the gut." Obesity and its other associated diseases such as diabetes are truly a reflection of gut disease. Maintaining gut bacterial balance and diversity is the key factor in achieving optimal weight. Scientific research done on mice shows that when gut bugs from an overweight person are transplanted into thin mice, these mice eventually become overweight, despite being fed on a normal diet. Isn't that amazing? Correcting the gut microbiome in humans is achieved through testing, prior to the planned weight loss procedure and appropriate dietary and nutritional interventions after surgery. So you see, having an integrative approach to weight loss surgery will not only set you up for a successful outcome after surgery, but will also provide you with the tools that will ensure long-term success. We have a team of highly experienced and passionate integrative doctors, dietitians, naturopaths, wellness coaches, and personal trainers who have helped several individuals undergoing weight loss surgery achieve and maintain their results in the long term. I hope you found this information useful, and if you would like to know more, call us today or send an inquiry via the link below. I wish you all health and success. This is Dr. Arun Dhir from the Center for Integrative Gut Surgery and Weight Management.